abnormal na pump sa naton heart. Next, we have the side effects and adverse reaction. First, we have this epinephrine. The side effects and adverse reaction of epinephrine include tremors, hypertension, tachycardia, heart palpitations, dysrhythmias, and angina. The client needs to be monitored when epinephrine is administered. Okay, sa epinephrine naman, bagang hindi talaga siya common na ihatag tasan or administer ta sa atong patient. Kasi, there's a lot of side effects or the adverse reaction na maaari makita naton sa usad sa pasyente naton. Kasi nga ni, ang mga side effects, tremors, hypertension, tachycardia means heart rate over 100 beats per minute or the rapid heartbeat. Next, heart palpitation, dysrhythmias, and angina. So, pag na-administer naton ini sa aton patient, we should make sure na i-monitor ta talaga ang patient naton as soon as possible. Kasi it is very stated naman na kapag gina-administer ang epinephrine, dapat monitor ang patient natin kasi nga dili siya common to give to our patient rather. Next, we have beta-2 adrenergics. The side effects associated with beta-2 drugs and the generic name of it is albuterol, terbutaline include tremors, headaches, nervousness, increased pulse rate, palpitation because of this high doses, and minimal lowering of the blood pressure. The beta-2 agonist may increase blood glucose levels. Diabetics who take beta-2 agonist should be thought to closely monitor their serum glucose level. So, ang mga diabetic person or ang diabetic patient naman na nag-take sa beta-2, dapat ginamonitor na sinda permi kung ang glucose levels ninda is nagataas or nagababa gihapon. So, here are the side effects of the beta-2. Agonist may diminish after a week or longer. So, nakikita natin ang side effects sa beta-2 after a week or longer. The bronchodilating effects may decrease with continued use. It is believed that tolerance to these drugs can develop. If this occurs, the dose may need to be increased. Failure to respond to a previously effect dose may indicate worsening asthma, requiring re-evaluation prior to increasing the dose. Okay, sa beta-adrenergic bronchodilator or the metaproterenol, amo ni siya ang preferred naton, ang most suggested talaga na bulong, metaproterenol. Ang generic name sana niya is alopent or metaprin. So, here is the contraindications. Hypersensitivity, caution, narrow angle glaucoma, cardiac disease, hypertension. And the interaction naman is sympathomimetics, beta blockers. So, sa pharmacokinetics, there is absorption. The PO will absorb. Distribution, the protein binding is unknown. Metabolism is half-life unknown. Elimination, excreted as metabolized in the urine. So, sa pharmacodynamics, there is by mouth, onset, 15 to 30 minutes. Tapos, peak time niya is 1 hour. Tapos, ang duration is 4 hours. Inhalation, the onset 1 to 5 minutes. The peak time is 1 hour. And also, the duration is 3 to 4 hours. So, here is the therapeutic effects. Treat bronchospasm, asthma promote bronchodilation. So, here is the side effects of the metaproterenol. Nervousness, tremors, restlessness, insomnia, nausea or vomiting, and hyperglycemia. Next, adverse reaction. Here is the tachycardia, palpitations, cardiac dysrhythmias, hypertension, and cardiac arrest. Okay.
Action.
Next, we have the sympathomimetics or the adrenergic bronchodilators. So, here is the drugs, dosage, uses, and consideration. So, the first drug, we have the epinephrine. The generic name is adrenaline, primatine, mist, bronchide mist. Okay, the dosage of epinephrine is for adult, igwasan, sa adult, Ang route niya is subcutaneous, 1 to 0.5 milligram or ml of 1 to 1,000 solution. Next, we have for child naman, subcutaneous gihapon ang route, 0.1 milligram or ml of 1 to 1,000 solution. So, ang inhalation niya, we have the 1 to 2 puffs of 1 to 100. And its uses and consideration for acute bronchoconstriction non-selective, the alpha, beta 1, and beta 2. Adrenergic drug, used frequently as a nebulizer. Nebulizer siya. Next, we have the oral and nasal beta adrenergic bronchodilators. The first drug, we have the isoproterenol, or the generic name is isoprel. Ang dosage, 1 to 2 inhalations. For adult, the route is sublingual, 10 to 20 milligram. Ano siya? Per 6 to 8 hours. I mean, every 6 to 8 hours. Next, for child naman, sublingual gihapon, 5 to 10 milligram, every 6 to 8 hours gihapon siya. Same lang. For bronchoconstriction, selective beta 1 and beta 2. Beta 1 effect causes heart rate to increase. It is its uses and consideration. Next, we have the metaproterenol or the allopen, metaprel. So the dosage, we have 1 to 2 inhalations. For adult tan talaga ining metaproterenol. We have the by mouth, 20 milligram, 3 times a day. Next, for bronchoconstriction, I mean the uses and consideration, we have for bronchoconstriction, mostly beta 2 with some beta 1 effect, rapid onset 1 to 5 minutes. Short duration, ang pinaka-short duration sana is 4 hours. Next, we have the isoetherine or the bronchosul, 1 to 2 inhalations. Ang dosage, for bronchoconstriction, mostly beta 2 with a weak beta 1 effect. Rapid onset is 1 to 6 minutes. Short duration is 1 to 3 hours. Next, we have, terbutaline, breath-in or breath-in, 1 to 2 inhalations. For adult, we have by mouth, 2.5 to 5 milligram 3 times a day. Also for adult, subcutaneous ang route, 0.25 to 0.5 milligrams. Uses and consideration for bronchoconstriction, mostly beta 2 with a weak beta 1 effect, slow onset 5 to 30 minutes, long duration 3 to 6 hours. Next, we have albuterol or proventil ventolin. Dosage, we have the 1 to 2 inhalations. For adult, we have by mouth, 2 to 4 milligram 3 times a day or 4 times a day, maximum 8 milligram or in 4 times a day. For bronchoconstriction, we have beta 2 effect, slow onset 15 minutes, long duration is 3 to 6 hours. That's all, ma'am. Thank you.